Hi everyone, welcome to Alpha Tech Series 15. Myself, Dr. Amarneni Ravi from Alpha Biologicals, Nellore. White spot virus causes huge economic loss to the shrimp farming industry. This presentation is on white spot disease caused by white spot syndrome virus, its signs, symptoms, and confirmatory diagnosis. As you know that there is no treatment for viral diseases, but it can be prevented with proper biosecurity. All the biosecurity measures will be covered in another Alpha Tech series. There are certain misconceptions like if we apply some chemicals and induce the shrimp to molt, white spots will go, and shrimp will be healthy. In this presentation, I will clarify on some of the misconceptions like this. Coming to the signs and symptoms of white spot virus, anorexia means lack of appetite, body turns red, antenna cut, shrimp comes to the surface. In some cases, we can see the fluid accumulation in the head. This is known as edema. In some cases, we can also see the white muscle, especially at 6th abdominal segment. The mortality starts and then disease spreads by cannibalism. All these symptoms are not specific to white spot syndrome virus. Hence, there is a need for a confirmatory diagnosis. For scientific publication, we must use minimum 2 diagnostic techniques to confirm a disease, but for a farmer to take a harvesting decision, one test, that is lateral flow test strip or rapid dot test, is enough. And this is white spot on the carapace, and this is edema. You can clearly notice accumulation of fluid in head region. You can also notice the gap between cephalic region and abdomen. Here, the left one is Peneus monodon or the tiger shrimp. The right one is L. venami. Both are infected with white spot syndrome virus, but monodon, the spots are clearly visible. This is venami. Both the shrimps are from the same pond. White spots are clearly visible on the top one, but on the other shrimp, white spots are visible when the carapace is removed and epithelium is scraped off. In some cases, we can see white muscle like this, especially in 6th abdominal segment. And this is severe infection of white spot virus. You can clearly see redness of the body, spots on the entire body. This is very severe. And the diseased shrimp will come to the sites, struggle for some time, and then they'll die. Then the cannibalism starts and the disease spreads. In this case, first the shrimp has got black gill disease and later infected by white spot disease. Mortality will be very high in such cases. And this is very interesting case. Farmer started harvesting the pond. When I asked him, he told me pond has got white spot disease. When tested with kit, it came white spot negative. When closely observed, it has got severe gill fouling. I told him to stop harvesting and treat for gill problem. The pond recovered and was harvested at 40 count. So, we must go for a confirmatory test before taking a harvesting decision. And this is a very healthy pond without any mortality. we can see several white spots on molted shell. Not all the spots are caused by virus, and this is not at all a virus case. This is a close-up of carapace with several morphologies of white spots, and this is under microscope. No spots are seen, and this is white spots just developing. This is the spot caused by virus. This is also by virus. This is also by virus. Here you can see 2-3 spots are fused together, and this is also by virus. And here the 4 spots are fused together, and here the spots are of star shape. All these are caused by white spot virus, and we have confirmed it with a confirmatory diagnosis. And this is very important, interesting slide. And this is the morphology of white spot in juveniles, especially below 30 days. So its morphology is distinct from others. You can see radiating lines from the center of the spot. And this is another important observation. This is a typical morphology of white spot in Peneus monodon, or the tiger shrimp affected with white spot syndrome virus. You can see white spots and dark spots inside each spot. This is very distinct. So there are several morphologies, and this is a typical non-viral white spot morphology, and this is also a non-viral white spot caused by Bacillus species. So it's very important to note that not all white spots are caused by white spot syndrome virus. Let us go back and look once again. Viral normal carapace, white spot developing, viral white spot, viral, 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 and this is viral. And in juveniles, this is in Peneus monodon caused by white spot virus, and this is non-viral, and this is non-viral. So for the presumptive diagnosis, we observe the gills under microscope. The black arrow is normal nucleus with nucleolus in the center, and the red arrow is hypertrophied nuclei. As the white spot syndrome virus is a DNA virus, it forms inclusion bodies in the nucleus of the host. This is another wetment of gill filament with hypertrophied nucleus. And this is a technique called rapid gill staining. You can clearly see the normal and hypertrophied nucleus. During introduction, I have mentioned about a misconception. That is, by applying some chemicals, we can induce the shrimp to molt and get rid of white spot. So in white spot disease, shrimp is not dying just because of white spots. In case of humans, we will not die due to loss of leg or hand, but if there is a damage to the vital organs like head, liver, kidney, heart, etc., we will die. Same is the case with shrimp. Also, white spot virus damages several organs like stomach, hematopoietic tissue that is responsible for the development of blood cells, antennal gland, gills, lymphoid organ, uropods, and cuticular epithelium that is responsible for the formation of outer exoskeleton. So all these organs are damaged at a time. That is why the mortality is severe in case of white spot disease. No other virus damages several organs at a time. And this is the electronic microscopic picture of white spot virus in the nucleus. Coming to the confirmatory diagnosis, several methods are available like polymerase chain reaction, histopathology, fixing the shrimp with Davidson's fixative and staining with hematoxylin and eosin, rapid gill staining, rapid dot test. This is antigen antibody based, developed by Mangalore Fisheries College, and the lateral flow test strip. This is also a immunodiagnostic kit. Both rapid dot and lateral flow test strips can be used by the farmers on the farm. On the top, it is the eye screen test. This is a old technique. We are not using this now. On the bottom left, this is the lateral flow test strip. So it's very easy to use by the farmers. I already uploaded a video on this. On the bottom right, it's a traditional PCR. This is a pocket system. This is a very innovative and easy to use. This kit is OIE approved, and this is DNA extraction in pocket system, and this is pocket PCR machine. The entire reaction takes place 1 hour 15 minutes only. In pocket kit, if the sample is positive, we can see 2 red color positive signs. If the sample is negative, we can see negative in green color and positive, that is test control, in red on the bottom. If there is white spot virus outbreak, if we cannot diagnose in time and harvest the pond, there will be mass mortality. On the other hand, if we harvest the pond by seeing white spots, we may miss a good harvest. So it is always advisable to go for a confirmatory test. Survival of the virus outside host. The agent is viable for at least 30 days at 30 degrees centigrade in seawater under laboratory conditions, and is viable in ponds for at least 3 to 4 days. Laboratory emulations of drainable and non-drainable ponds suggest that the virus is no longer infective after days 21 of sun drying or after 40 days in waterlogged pond sediment. And coming to the stability of the virus, 0.5 ppm of virus for 10 minutes can inactivate the virus. Chlorine, BKC and iodophore at 100 ppm for 10 minutes can inactivate the virus. Coming to the triple salt, if you refer the website of a triple salt manufacturer, they have clearly mentioned that it can inactivate the virus at 1:100 dilution. That means for every 100 liters of water, 1 kg of triple salt is required to inactivate the virus. What we are applying is around 500 grams to 1 kg per acre. At this concentration, it may control the Vibrio but not virus. So coming to the carriers of the virus, there are more than 100 carriers are reported for this virus, like crabs, mollusks, polychaete worms, artemia, insect, bird, etc. No other virus has this many carriers. That is why this virus spreads very fast. So finally, misconceptions like application of chemicals to induce molting and get rid of virus is not correct. Other misconception is that Vibrio converts to virus after some time. Vibrio never converts to virus. Vibrio is intercellular virus, intercellular pathogen, and virus is intracellular pathogen. Vibrio lives in between cells and virus lives inside the cells. Moreover, Vibrio is the natural flora. It's naturally present in the shrimp, but virus is not natural flora. And coming to the triple salt, as I already mentioned, with the dosage of triple salt, we may control Vibrio, but we cannot control virus. And if there is a virus outbreak, please communicate to the fellow farmers. Please don't say that it is just vibriosis. So if you convey the correct message, they can take necessary precautions to prevent the spread of the virus. And finally, don't harvest the pond just by looking at the spots. It is always advisable to go for a confirmatory test like rapid dot or lateral flow test strip. So that's all for now. Hope this presentation is useful to you. Thank you very much. You can follow us on our Facebook page, Alpha Biologicals or Aquaculture Professionals, or you can also reach us on our WhatsApp number 9848667776. We are happy to respond. Thank you once again.